want to miss our morning services. 10:30 a.m. our men's ministry and fellowship. Also a panel discussion. Topic, living amidst a pandemic. Living amidst a pandemic. Our host is Elder Ondrei McCullough. The panelists, Pastor James L. Foster Jr., Ms. Joanne Foster Bishop, Mr. Paulo Hudson, Mr. LaDarius Price, and Dr. J. Sizemore III. At 12 o'clock, Christian women, presiding Lady Aurora Brazil. Speaker, Pastor Lua Crayon of Spoken Word, Evangelistic Outreach Church, Douglasville, Georgia. Now, are you all ready to go before the throne of grace?
Welcome to the Georgia State Council Men's Ministry Midday Session panel discussion. Our panel discussion is living amidst a pandemic. We have been blessed to have on the panel today Elder James Foster, pastor of the Worship Center of the Apostolic Church in Chattanooga, Tennessee. He is currently the men's ministry leader for the Georgia State Council. Elder Foster will be talking to us regarding his COVID experience, my COVID experience. And so, Elder Foster, welcome to the Georgia State Council Men's Ministry Midday Panel Discussion. Please tell us about your COVID experience.
Yes, sir. Thank you, Elder McCullough. I'd like to say thanks to all of the panelists. And before we get started, real quick, I want to just give honor to our diocesan bishop, Bishop J.D. Guthrie, and to our chairman of the Georgia State Council and to our entire executive staff. I wanted to just share briefly with you all regarding my COVID experience. And one of the main reasons why I was chosen to do this is because a lot of time it seemed to be more impactful when you hear testimonials from people that you know. Okay, so that's the purpose that I'm coming to you. And so my COVID experience started. It started actually right before Thanksgiving. Right before Thanksgiving, my father-in-law had passed away. And me, of course, being a pastor, I was called upon to do his services. And so I wanted to just interject that because I feel like as far as tracing the COVID coronavirus, feel like it was probably somewhere around that time that I actually contracted the virus. And maybe say 4 or 5 days afterwards, I had a doctor's appointment that I had basically put off because of his passing. So just a routine checkup, but nonetheless, so we probably buried him somewhere around midweek. And my doctor's appointment was the following Wednesday. So after we buried him, I went through my church process and went back to work on Monday. On that Wednesday morning, the first signs of COVID, I didn't really understand what was going on at that time. But on my way to work, I stopped by and got some coffee from a service station. That didn't taste right. I thought maybe it was just them not really doing what they were supposed to have done. But then I realized as the day progressed, lunchtime came and just the same, my lunch did not taste correct either. So I had a doctor's appointment on that particular day for 2:30. I left work around 1:30, and just want to give you some idea of how quick this virus affected me. So I left work around 1:30 and went to the doctor's appointment. I showed up there maybe say 2 o'clock. The first thing they done was sign me in and took my temperature. Well, once they took the temperature, they requested that I would go outside and stay in my car. They said that the temperature had shown that I had at the time a low grade fever. And once the nurse called me, they told me that they would not be able to allow me to come into the facility because of that fever. And they recommended that I take a COVID test on the following morning. Now, my doctor's office is maybe 20 minutes, 15 minutes or so from my church. I had to come by my church because I had contractors that was already on site doing something, okay? So just to give you an idea of how quick that virus actually affected me, by the time I drove from my doctor's office to my church, I was completely demobilized. I could not walk. I don't know what it is about it, and I'm sure the doctors that's on the panel will be able to explain more. But I did not have the strength to walk. So I finally made it to my house, and I went into an extra bedroom. My wife found me there when she got off work some hours later, and I had basically quarantined myself in a room. So now this was Wednesday. I had a COVID test on that following day, which it took some days actually for me to get my test results. So this was Wednesday. I stayed home from Wednesday. On Friday, my son had already begun taking ill. So he requested that I get up and take him to one of the clinics where he could get a rapid test. So this is when I really realized that COVID was definitely in our home, because I took him there, and it wasn't long after he came out and said that he had received a confirmed positive result. So that let me know that definitely the coronavirus was in our home. So now he's sick, I'm sick, and mine started on Wednesday. I stayed around the house, maybe say until Saturday, that Saturday. And every day, every moment seemed like I was just declining. I was losing strength. It became very difficult for me to even just go from the bedroom to the restroom. And so I received a phone call from my daughter. She actually FaceTimed me on that following Saturday. And when she saw the state that I was in on that Saturday, she became very concerned, and she got my wife on the phone. And long story short, they took me to the hospital, to the ER. Little did I know, when I got to the ER, my oxygen level had already dropped to 74. It was already down to 74. I didn't realize it because at the home, I was of course taking my temperature, things like that, but I did not know anything about taking my oxygen levels. Okay, so right off, they admitted me right into the hospital. I stayed there on oxygen for the next 6 or 7 days. Okay, thankfully, I did not have to go on a ventilator, but it was a very, very terrifying thing to when you think you are so strong, but then you have something that hits you so quick and basically demobilize you. And so after talking to physicians in the hospital, I didn't realize how close I was to a ventilator and even possibly death. Okay, so that has been my COVID experience. And then when I was in the hospital, physicians and nurses came in, and just to hear them one after the other tell me how many people they treat that really did not believe that COVID-19 was real until it actually hit them and they found themselves on ventilators at the point of death. So I wanted to come on and give my COVID experience as an individual that you know from the Georgia State Council. By all means, let's not take it lightly. It is still a viable threat. We need to really take care of ourselves because this virus is real. It threatens our life and our health. Okay, and on that note, of course, I'm thankful for the physicians and all of those that's in the medical field that helped me. But at the same time, I can't give them thanks without giving the body of Christ thanks for the prayers to our diocesan bishop, to my dear friend, Elder John Pitts. I'm just thankful for everybody who solicited me in your prayers, because I know that had it not been for the effectual fervent prayer of the righteous, this could have definitely went the opposite direction. So that's my COVID experience. And I just wanted to share that with you in hopes that that will give you some idea that it is real. And hopefully it would help you to look out for yourselves and for your families. Thanks for your time.
Thank you, Elder Foster.
Yes, sir.
I just want to say, in case you haven't experienced this virus, and in case you haven't encountered or been associated with someone who has experienced this virus, maybe perhaps you haven't looked at the news and saw the number of individuals who have lost their lives because of this virus.
Yes.
We have our very own Elder James Foster, a face, a person that you know, who've just explained and discussed their personal experience with this virus. It is very real. We are grateful to God that he's still here. His family is fine, doing well now after having experienced this virus. I'm grateful for the organizational SIMPA.
Yes.
I was told, I asked about that word, and Mr. Price told me that that word is the old English root word for champion. I am grateful that we have in our presence today Dr. Sizemore, Dr. J. Sizemore, and Mr. LaDarius Price, who is Community Outreach Director, both here to explain to us from different points of view things that we can do to beat this virus. My Bible tells me that my people perish, or my people perish for lack of knowledge. These two professional individuals are going to share with us today some knowledge that can help us win this war on COVID-19. Next, we will have, I want to introduce to you Dr. J. Sizemore, Chattanooga native and Baylor School graduate, received his bachelor's degree of science and psychology from Duke University, his medical degree from the University of Tennessee College of Medicine. Following medical school, Dr. Sizemore completed an internal medicine internship and residency at John Hopkins Hospital in Baltimore. His professional education culminated with an infectious disease fellowship at the University of Alabama at Birmingham, during which he also earned his Master of Science in Public Health. He joined the faculty at the University of Alabama, both participating and teaching medicine before returning to Chattanooga in 2005. Currently, he is a partner in the ID Group, PLLC, and is the Infectious Disease Division Chief at the University of Tennessee College of Medicine, Chattanooga. Dr. Sizemore is the medical director of the Antimicrobial Stewardship and Infectious Prevention Programs at Erlanger Health Systems. In 2016, he was appointed to the Hamilton County Regional Health Council. Dr. Sizemore was elected as the 2018-2019 Chief of Medical Staff for Erlanger Health System. Since 2005, he has served as the Chief Medical Officer at SIMPA Community Care. I'm going to go on. As Chief Medical Officer, Dr. Sizemore has been integral in spearheading healthy initiatives for SIMPA's patient population. With the introduction of new treatments for hepatitis C in 2014, Dr. Sizemore made it a priority to treat patients co-infected with hepatitis C and HIV. As a result, 96% of all HIV positive individuals who received medical care at SIMPA have been cured of their hepatitis C. Another major accomplishment is the expansion of clinical services to not only include primary and infectious disease care to people living with HIV, but also providing pre-exposure prophylaxis or PRED and hepatitis C treatment to mono-infected individuals. Lastly, through his leadership, the SIMPA Community Care Clinic currently has HIV viral load suppression rate of 91%. National viral suppression is only 60%. I want to introduce to you right now, Dr. J. Sizemore.
Thank you, Elder McCullough. I appreciate that introduction. I appreciate what Elder Foster shared. I want to piggyback on that to a certain extent to introduce my comments. Certainly as an infectious disease physician and a person who has training and interest in public health, COVID-19 is very real to me. I've been involved in the care of countless numbers of individuals at Erlanger Health System who have been hospitalized, like Elder Foster was. Unfortunately, I've also been involved in many of those who were not as fortunate as he was and have lost their lives to this infection. So indeed, it is very real to me, continues to be very real. At the current rate that we're losing American citizens over the last 4 weeks, it is the leading cause of death in the United States. It is currently killing more people than cancer, than heart disease, than stroke, murder, suicide. It's the leading cause of death in the US. We've lost 395,000 of our citizens to date. We've had over 24 million US citizens that are infected, and every day we seem to be hearing about more and more cases, more and more deaths. So I'm here today to talk to you about what are the strategies that we can use both as individuals and as a community to combat this infection. So as with any infection, really, there are two approaches to it. The first approach I'd like to cover has to do with the treatment of COVID-19. That conversation is going to be rather brief based on currently recommended therapies. I'm going to spend the majority of my time focusing on ways that we can prevent the infection, because we have much better strategies to prevent COVID-19 than we do to treat it. So currently there are treatment guidelines, many treatment guidelines across the world and a few in our country. The ones that most of my colleagues and I turn to are those at the National Institutes of Health and the Infectious Diseases Society of America. And both of those bodies of experts are composed of individuals like me who have an interest in infectious disease, have medical training, are able to look at the available data that are out there and make recommendations to practicing providers like me as to which strategies will work best. This is a brand new infection. We're learning new things every day about it. things that I may tell you today may not be true in 3 months or in 6 months. So I want to put that out there right up front. Just like if I had been giving this talk 6 months ago, my message would have been much different. But we're in a good position now. I can only imagine how tired and fatigued we are from doing this over the last 9 months now. But the key message is we must be resilient in the next few months to do our part in ending the pandemic. So unfortunately, if you are to get COVID-19 and you're not sick enough to be in the hospital, there are no currently recommended therapies or medicines that you can take. So what that means is this is supportive care. It may be like a bad flu or a really bad cold, but essentially we're just going to try to support you in the outpatient setting, and the overwhelming majority of people will get better. Certainly, if you have other health conditions or are older, your risk for having complications may be higher. But we can't tell one person you're not at risk for complications and another person you are. This infection spares no one. So again, supportive care if you're an outpatient. You know, the best thing that you can do if you have this infection is stay at home, stay away from other people, and do your best not to spread the infection. Okay, I recognize that's hard. We all live in homes with our families, and it's often hard to stay in separate areas, use separate bathrooms, eat at separate times, be away from your loved ones. So I recognize that it's difficult, but that's the most important thing you can do if you are at home with this infection. The only two currently approved medications for COVID-19 are for those individuals who are sick enough to be in the hospital and require oxygen in order to maintain the levels that they need in their body. There are two therapies. One is a very old one. It's a steroid called dexamethasone. The other one is a new one. It's an antiviral medication called remdesivir. So depending on, once you're in the hospital, depending on how sick you are, how much oxygen you're requiring, and whether or not you need to be on a ventilator, you may be on either one or both of those medications. So the guidelines that I mentioned earlier, the two guidelines I mentioned earlier, they're very consistent in their current recommendations. So what might you hear if you turn to the internet or you turn to other medical professionals or maybe not medical professionals in your community? There are lots of different therapies that may be suggested to you. For example, vitamin C, vitamin D, zinc, an old antiparasitic medicine called ivermectin. We heard a lot early on in the epidemic about hydroxychloroquine. There are lots of medications that you may hear about, an old HIV medicine called Kaletra. But the bottom line is the two medications that I've mentioned earlier are the only two that are currently recommended by these experts, our country's infectious disease experts, to combat this infection. Okay, so we need to remember that. We need to remember the limitations. Our hope moving forward as we continue to study this virus and therapies that are available for it, we will have more therapies to offer, both for patients in the hospital as well as those who are at home. With that being said, I want to turn to the prevention side of my message. This is where we as a community can do a few simple things and not hesitate to do one big thing that can lead this pandemic to an end. So I'm going to talk first about mitigation strategies. We've all heard about those. Those are social distancing, wearing a mask, hand hygiene, staying away from poorly ventilated indoor areas, staying home if you're sick, getting tested, and getting your contacts traced if you turn out to be positive. Those are the strategies that, if done well, in and of themselves will drive the pandemic to a near halt. It's been demonstrated in countries like Australia and New Zealand, where the entire population came together as a unified group, respected the scientific opinions of the public health experts, implemented the strategy, and drove their case counts essentially to zero. We unfortunately have not been able to do that in our country, but there's still opportunities to save tens of thousands of lives in the next few months by recognizing the potential of this strategy. In addition to augmenting the strategies that I just discussed, we now have, as I'm sure each of you have heard, highly effective vaccines that are available for COVID-19. There are 2 vaccines that have currently been approved under an emergency use authorization by the FDA. Although the United States has gotten off to a sluggish start with distributing these vaccines and getting them into individuals' arms, I expect it to improve and accelerate over the next few weeks. I've taken both of the vaccines that are currently approved. The Pfizer and the Moderna vaccines are 2-shot series. These are not live vaccines. They're a type of vaccine called messenger RNA vaccines. So essentially they deliver a part of the virus that your body is then able to recognize and mount a defense against, so that if it ever sees natural infection, the course of illness will either be prevented altogether or will be milder in the overwhelming majority of cases. I personally have received both injections of the Pfizer vaccine. I've tolerated them well. I did have a sore arm with both injections, but I feel very strongly that as a public health and infectious disease leader in my community, that I need to support this vaccination, and I need to get the message out to my community members that this is going to be a key towards driving this epidemic to an end. Many of you may be hesitating as to whether or not you want to receive this vaccine, or whether or not your family would want to receive this vaccine, and that hesitancy is well recognized. I would ask you to consider that there's nothing more regulated in the medical field throughout my entire career, whether it be devices, drugs, more than vaccines are. So again, there is, although this technology seems to have come to market very quickly, it is currently being recommended by the vaccine experts across the country, and they center in a central body at the Centers for Disease Control, and these vaccines are being recommended. So remember, there's a whole lot of therapies that have been considered. Only 2 to date have been recommended. These 2 vaccines that are currently available are both recommended, and in combination with the mitigation strategies I discussed earlier, will be keys to driving this epidemic to an end. So in order to do that, in order for the vaccines to work, and they are highly effective in the controlled setting of a study, but in order for the vaccines to work, they must be used in combination with strategies to drive down the case counts, the record number of cases of COVID-19 that we're seeing right now. And so I'm really calling on you today to think hard about those mitigation strategies. I will continue to wear my mask for the foreseeable future. My hope is if we can be better at enacting these mitigation strategies, and we can get a significant proportion of the population vaccinated over the first half of 2021, we will make a significant dent in this pandemic and be able to resume some sense of normalcy. So again, recognizing that you all have never met me in person. And I can't expect for you to trust completely what I'm saying, but I'm a vaccine advocate. I've stood behind my stance. I've taken the vaccine. I've encouraged my family to take my vaccine. And when it's your turn, when it's your age group, when it's your comorbidity, your underlying illness that makes you a candidate for this vaccine, if you're not already a healthcare worker who's received it, I would encourage you to take that opportunity to take the vaccine. It may save your life. It may save your family member's life. It may save your loved one's life. And it may save members of your community and American citizens' lives. So please consider that. And again, I appreciate the opportunity to come before you today. Thank you very much.
Thank you, Dr. Sizemore, for all of that information. We talked about strategies, therapies, and vaccines. And we really need that information regarding the vaccines. Our communities are hesitant and reluctant. We're skeptical about this vaccine. However, more information we receive from professional individuals like yourself, it's valuable, it's priceless. So I thank you for that. Anybody that's wanting to maybe research Dr. Sizemore, his name is Dr. J. Sizemore with SIMPA Community Care. And we read his bio. You can go back and listen to this recording and listen to his bio. Very impressive bio. This is a man that qualifies to give the instructions, to give the information that he just gave. And we want to say, I want to pause and say thank you. Thank you, Elder Foster, for your My COVID experience. Thank you, Dr. Sizemore, for the strategies, therapies, and vaccine information you just gave to us. And we're going to finally, we arrive to Mr. LaDarius Price. LaDarius Price is a community outreach director. So now we've come from the family with COVID. We've listened to the doctor on some of the very valuable strategies, therapies, and some information even regarding the vaccine. But now we're going to get out into the community. We're going to get out into the community with someone. This is what he does. Community Outreach Director at SIMPA. And let me read his bio to you. LaDarius Price is a native of Chattanooga, Tennessee. He attended Brainerd High School, Brainerd High School, where he graduated at the top of his class in 1999. LaDarius went to Chattanooga State Technical College, where he majored in special education. LaDarius went to Austin Peay State University, where he continued his course and studied his special education. LaDarius obtained his first teaching job educating preschool age kids in Nashville, Tennessee. He also taught special education and coached basketball for 4 years at Maplewood High School in Nashville, Tennessee. Returned home in 2013 to educate students in Hamilton County, Tennessee, and North Georgia on how to build healthy relationships. He coached basketball at his alma mater for 5 years, where he helped lead them to several district and regional titles and Class AA state runner-up. LaDarius is now Community Outreach Director for SIMPA Community Care, where he leads their efforts in building healthy communities. LaDarius has been honored several times by magazines, newspaper articles, community awards, and hosts of others. Notable recognitions for his continued work in the city, state, and county. LaDarius has spoken all over the country for the fight to end health disparities and ending the HIV epidemic. LaDarius is the president of Peak, a nonprofit in Chattanooga, Tennessee that stands in the gap for undeserved kids. I'm sorry, that's underdeserved kids. LaDarius is happily married to Dominique Price, and they share 5 children: Kadarius, Kendall, Harper, Bailey, and Demi. I introduce to you Mr. LaDarius Price.
Thank you, Elder McCullough. I really appreciate that. I also really appreciate Pastor Foster for thinking of us as an organization, as we continuously serve, not only here in Chattanooga and surrounding counties, but really our work is known all over the country. And I'm also just really eternally grateful for Dr. Sizemore and all of the work that he continues to do for our organization. And he and I don't, cross paths very much because I'm out in the community and he's seeing patients. But I understand, the team aspect of it. Without him, there is no me. There is no me for me to go out into the community and educate people on what it is that we truly do. So I'm not going to take up a lot of time. He's really drove home the point as it relates to COVID, and Pastor Foster has really driven home the point of what it looks like to experience it firsthand. And I'm going to, just bring it on home. And it's not going to take me long at all. I'm not a long-winded individual, but I am a realist. I am a very transparent individual. Something that Elder McCullough touched on when he brought up the scripture of our people perish because they lack knowledge. And then in this instance, in this season of this pandemic, there are so many minorities that are perishing because of our lack of knowledge as it relates to COVID-19. I've been blessed and fortunate to serve on the front line. I'm a frontline responder as it relates to going out in the community during this time and engaging and educating people that look like me as it relates to COVID-19. SIMP has been, fortunate enough to go into communities. When this first started back in March, there was not a lot of testing being done. There was not a lot of testing at all being done in underserved communities, in minority communities. And so what we've been able to do is to go into those communities here in Chattanooga and provide testing, what we call mobile testing. So we're bringing it right to their doorstep, even from the standpoint of providing transportation, having transportation to go to individuals' homes and bring them to the testing site to be tested, because we understood the importance of making sure that minorities, and I really don't even like to use that word, but African Americans and Latinos and Hispanics had the same opportunity as it relates to healthcare as everyone else during this time. So that's why we are, SIMP is the old English root word for champions. We're champions for your cause. That's what, and that's who we are. We stand in the gap for those who cannot stand, and we advocate for those who don't have a voice. And so during this time, I will say, at the very beginning of it, I heard everything under the sun from people that look like me. COVID is not real. COVID does not affect Black people. I'm not going to be tested because they're inserting a chip up my nose. And I heard everything that you could possibly think of as to why they didn't want to get tested. We're not going to get tested. And then a couple of months down the road, it started to really hit our communities. And the reason why it hit our communities so hard is because we have so many underlying health issues as opposed to our white counterparts. And even during that time, it was a struggle for even me to go out and educate, because then we shifted to, well, why are they targeting us? It's not that they're targeting us, they're just giving the facts. And the facts are, we're more likely than our white counterparts to have hypertension. We're more likely than our white counterparts to have diabetes. we're more likely than our white counterparts to have high blood pressure. And the list just goes on and on, okay? And so when COVID hits our system and we already have all of those underlying issues, it makes us more susceptible. And it just truly does. And that's just me kicking the facts to you as straight as I possibly can. And so as, we continue to go out and, during this time when school was shut down, we've gone out and we've served lunches day in and day out in these same communities. Let me also make sure that I highlight the fact that we're able to go into these communities and do testing and all of these other things because we've already established a relationship. And that helps when you talk about the distrust in the medical field that so many minorities have. They have that distrust because of things that have gone on in the past. And I'm not saying that it's not warranted in some instances. But what I am saying is that just like, and I'm going to finish up as it relates to the vaccine, we want to make sure that we have the same opportunity at all of these things as everyone else. And so we've been able to go into those communities and be successful and have high testing rates because we already have relationships with people. We're already serving those individuals. I don't call our patients that simple patients or clients. I call them family members because we're right there with them. We don't look down on anyone. We're not trying to pass judgment on anyone, but we're there primarily to serve them. And that's what we've done during this pandemic. We've ensured that people are served and they have the same opportunity at not only healthcare, but quality healthcare. When I look at Dr. Sizemore and our suppression rates on a national level, when you talk about it as it relates to fighting, HIV, and that's a whole nother pandemic that we've already been dealing with that a lot of people don't pay attention to. But when you see our suppression rates at 91 and on a national level, they're at 60, that speaks to having individuals within an organization that actually care. And that's one thing that I've seen, during this time, with the hospitals being run over with just people, them not having enough beds and things of that nature. It's really real. And that's why Pastor Foster's account of this is so important because he's allowing you to see up close and personal what he's had to deal with. And even though, I'm a youth pastor, so I'm a firm believer, but you have to couple your faith with common sense as well. Because I've even seen in our communities of faith where, God is going to heal me and he's going to do this, this, and this. That's all well and good. I believe he's going to heal me too. But at the same time, you have to have common sense to say, okay, I'm dealing with this. Just like Pastor Foss said, I'm dealing with this. I'm going to have to go. His daughter was like, we got to get our daddy to a doctor. He needs to go and he needs to be looked at. He needs to be seen by medical expertise. He needs to be seen by Dr. J. Sizemore so he can accurately diagnose him so we can get him the type of treatment that he needs. And so with all of that being said, and I'm going to finish up right here. This virus hasn't gone anywhere. And I'm not a fortune teller or anything like that. But from where I stand at and what I can see, it's not going anywhere for a good while. And until we start to take the necessary measures of wearing masks everywhere we go, of if you don't have to go anywhere, not going anywhere. My mother-in-law, she just recently, probably about a month and a half ago, she had COVID. And then right after that, probably 2 or 3 weeks later, she had the flu. Now, I'm going to say this because once again, I'm a realist. If she was at home the way that she should be, chances are she probably wouldn't have contracted COVID like that. But when you just feel the need that you got to go here and there, these are unprecedented times. This is not like it was a year ago. A year ago, I was sitting in my office talking about all of these outreach things that I was going to go out in the community and do. And then when March hit, that was over with. You scrapped that whole playbook, and then we had to start over. And we had to start to figure out how are we going to survive during this time. And for a lot of people, a lot of our loved ones, family members and friends, they have not made it through this journey. They haven't. They have not been blessed and as fortunate as a Pastor Foster. I have a very close friend, Chris Ramsey, who's going through this right now. A great man. When you talk about healthcare in Chattanooga, he's known all over, and he's dealing with COVID right now. He has, to think about putting it into perspective, just like Pastor Foster has a family. This is a man with a wife. He has a son in college, a son in high school, a daughter who's already graduated from college, and so many other people like me who he's mentored that are looking to him. And right now, for the past month, he's been in the hospital on a ventilator, and he's fighting for his life. So it's real. Like, these accounts that people are giving you, they're not just making up stuff just to sound good. We're not on here today because, we just want to seem like we're important. No, we're on here today because it's life or death at this point. And it's been that way for a while. And as we move forward, it will continue to be. Right now in Chattanooga, we're averaging about 600 new COVID cases a day. It's serious. Our schools are closed down. They're going totally virtual. My wife won't allow our kids to go to school. It really don't even matter what I say. She's just like, no, they're going to school virtually. So even when they go back in person, they're not. I have a son that plays football. He's pretty good. He's all state. With that being said, just to give you a snapshot of how serious this stuff is, even from a recruiting standpoint, it's been extremely difficult for him as he thinks about what college he's going to go to in the upcoming months, because they're giving seniors another year for college. They can't get out to recruit. He hasn't been able to go on any type of visits to a campus because campuses are shut down. So I said all of that to say it's very serious. And I plead with you. I know you don't know me. This is some of you all's first time seeing me, of course. But this is a very serious thing. It is affecting us greatly in our communities, and it continues to do so. And we just have to be smart. We have to listen. We have to use our God-given ability to listen and to key in and to take in the expertise of a Dr. Sizemore and to listen to the accounts of a Pastor Foster and to just use flat out God-given common sense in so many instances because we need you here. We want you here. I want to be here. And even as I go out every week and test people, and I go out and feed people and I serve and do community work, I'm being as careful as I possibly can. When I come home, I take off all my stuff in the garage, because the last thing I want to do is pass that on to my wife and kids. I'm not able to see my grandmother right now, who's a third parent to me, because God forbid I would give her anything that would cause her to not be here anymore at 81 years old. So it's a very serious thing. Once again, thank you so much for this opportunity of having us and Simple as an organization. Thank you, Pastor Foster, again, for thinking of us as we continue to serve these communities. And we will continue to do so at a very high level and with the spirit of excellence. Thank you.
Wow. CEMPA.
Yes.
Simple. Champions. These champions that we've been blessed to hear from today, these champions that have shared knowledge with us today are in the trenches. Now, we don't want Elder Foster to stay in that trench he was in, but we want these two others, Dr. Sizemore and Mr. Price, to stay in the trenches. We appreciate their hard work in those trenches because in this war, this is not a battle, this is a war. And they are in the trenches trying to help us win this war. And guess what? It's not like it's a war, the only war. As you read and heard, as we read Dr. Sizemore's bio, and we talked about, and we listened to Mr. Price's conversation there, they're already engaged in other wars, HIV, hepatitis C. They're already engaged in other wars. And they're in the trenches of this battle also, this war also, to help us be successful and victorious. I want to say thank you to Mr. Price. Thank you to Dr. Sizemore. Thank you for your time here today to share with the Georgia State Council everything that you've discussed with us today. This is a serious issue, and you could hear the passion in Mr. Price's voice as he tried to convince you, take this thing serious. Did not our hearts burn within us also as we listened to Mr. Price? Before he mentioned that he was a youth pastor, we kind of had a little knowledge that something was going on there in his heart. Something was going on there. He'd been around the fire for a little bit. So we appreciate individuals like both of these men that are in the trenches. I appreciate Elder Foster for what he's doing. And I want to say this, Mr. Price, you mentioned that this is our first time seeing you and Dr. Sizemore. I have a funny feeling that it's not our last time seeing you. You both are very professional and very knowledgeable about what we're dealing with, and we appreciate you. I want to say thank you to the diocesan bishop, Bishop Guthrie, for allowing this program to go on with the Georgia State Council Men's Ministry to offer this midday panel discussion. I want to say thank you to the chairman, District Elder Wayman Stroud. I want to say thank you to all of the pastors, especially my pastor, Suffolk and Bishop Stuart Reese III. I want to say thank you. I ask that you would listen to, rewind, play again, all of the information that was shared with you today. And I thank God for the victory. We always say when we end our Bible study, in Jesus, we have the victory. Yes. So God bless you. God bless you. God keep you. God give you strength. In Jesus' name, amen. Thank you.